My name is Phil McElnay. I am a medical doctor by training, and it's my real honor to share a little bit of our work with you today. And I'm going to share a little bit about our mission. And what we're really passionate about is making healthcare training accessible for everyone. And why is that important? Well, we face a global workforce crisis in healthcare. The World Health Organization explains that we need to train 18 million more healthcare professionals by 2030. That's 1/3 more healthcare professionals that are currently on planet Earth. Coupled with the cost of healthcare training, that's a real problem. It takes 15 years and up to $700,000 to fully train a doctor. And when you look at how the Lancet describe our current healthcare training capacity, we have a really toxic problem. The Lancet explained that we have severe institutional shortages in our healthcare training capacity. We need more doctors, but we don't have enough resources to train them. And unfortunately, where resources are at their least, the need is at its greatest. There are 11 countries in the world that don't have a single medical school. There are more than 20 that only have one medical school. And the proportionate spread of medical schools to the population is disparate throughout the world. There's up to 3 times less medical schools per capita on the continent of Africa compared to Europe and North America. But this isn't just a low-income country problem. We've actually seen in the headlines of high-income country press that we are facing a workforce crisis in high-income countries as well. Just in the last month, a headline on BBC News has been that we face the worst staffing crisis in the NHS's history in England. And it's the same across many other high-income countries. Why is that a problem? Well, this paper from the Association for Surgeons in Training from 2017, published in the British Medical Journal Open, actually explains the cost of healthcare training to the individual healthcare professional. And it talks about how healthcare professionals are having to spend up to £71,000 of out-of-pocket expenses on their own healthcare training, much of it on courses and conferences. And the typical range is between £20,000 and £26,000 in surgical training. And this is a real problem for many reasons. But when coupled with the reduction in our buying power as healthcare professionals when it comes to our salary of over 10% in the last 10 to 15 years, we have a real issue. And this really affects people. This is a tweet actually from this morning from Maria Prael, who is a medic in the UK. And she has said, as a widening participation doctor, money is and always has been tight. My study budget covers one big course or maybe 2 or 3 small ones. And to meet core surgical training needs, the wealthy can easily treat the application as a paid tick box exercise with little development. We really don't believe that healthcare training should be for those who have the most money, the best connections, or are living in the right places. We believe that it's really important, not just for individual healthcare professionals, but for patients, that we make great healthcare training accessible and within reach of everyone in low-income countries and in high-income countries. And that's what we want to do at MedAll. We want to make great healthcare training accessible. And we don't just want to do that for 1 or 2 healthcare professionals on a small scale. But if we're really to meet that big need that the world is facing, we need to do this at scale. We need to train and teach healthcare professionals to meet the world's needs. And how do we do that? It's a really grand and bold thing to want to do. We believe that the best way to do that is not to make this all about us. We know there are amazing healthcare organizations and healthcare professionals out there who are delivering teaching and training every single day. But the ways in which they're doing it and the tools that are available to them are not good enough. Just look at how we set up teaching and training at the moment. We set up an Eventbrite or a Google form, We bounce people to a Zoom call. In the Zoom call, we ask for feedback using another form, a SurveyMonkey or a Google form. We then copy and paste names into Microsoft Word documents and save them as certificates, download them as a PDF, and then email them to people. And then because catch-up is now a thing, we're downloading our videos from Zoom or Teams or wherever, because we only have a gigabyte of storage, and then we're adding it to another platform, Vimeo or YouTube or similar, and then we're adding another Google Form link to that video. And there's no actual guarantee that the person has watched that video. And typically, healthcare organizations and healthcare professionals are spending hours of their week administering training. And really, if we're truly to scale up the amount of healthcare training that we provide as Planet Earth, we need to do that better. Healthcare professionals should not be doing all of that administration. Your real skills are in delivering amazing teaching and training and to provide patient care, not all of the administration that goes with that. And so what we've done is tried to solve a real problem for those individual organizations and for those individual healthcare professionals to automate their healthcare teaching and training end to end. Registration, marketing, sharing the event across the healthcare community, automatically providing a video call like the one you're on today, automatically collecting feedback, automatically awarding certificates to those who provide feedback, automatically being able to add your content on demand on the same platform, and automatically being able to offer a feedback form and certificate to those who watch the event on demand. Why? Because that saves organizations and healthcare professionals precious time that can be reinvested back into teaching more healthcare professionals. But also, if this is done in a single place, we can all work together. This is a community effort. If you want to find cardiology teaching or orthopedic teaching or public health teaching, you can find that in a single place without us doing all of our teaching in disparate places and making it more difficult to find. If we can solve a real problem for healthcare organizations and healthcare professionals on the ground, if we can work together as a community, we can make that easier to share, easier to find, and we can train more healthcare professionals. That is what we're doing at MedAll. This is something that Dr. Tedros said, who needs no introduction to a healthcare audience, at a tech conference in the height of the pandemic. Ask yourself every day if your technology works to help the poorest in the world and to reduce inequalities. That's something we're really passionate about at MedAll. We cannot take our eye off our mission. Our mission is to make great healthcare training accessible for every healthcare professional everywhere, not just high-income countries, not just low-income countries, everywhere. And central to that mission is enabling colleagues from low and middle-income countries to be able to continue to attend events. One of the beautiful things that we saw throughout the last 2 years was suddenly healthcare professionals who may have never have been able to join conferences or courses to suddenly be welcomed in. We stripped out the travel costs. Many of us stripped out the ticket costs. Many of us stripped out the hotel costs, and we delivered accessible education. And just because so many of us can get back to face-to-face, it should not mean that we close the door on those precious colleagues who have been able to join. And that's why we created Fair Medical Education. We saw that so many organizations, some of them you see listed on the screen at the moment, we saw so many organizations who wanted to continue to welcome healthcare professionals from around the world, but didn't like the administrative burden of checking that they were actually from lower middle income countries. And that's why we created Fair Medical Education, so that we could help healthcare organizations who are delivering amazing teaching and training and conferences and courses to automatically offer free or low-cost tickets to colleagues joining from around the world. And I see Iggy in the chat box saying big shout out to the British Orthopaedic Trainees Association. I completely agree. This is a community effort. This cannot be just about us. This is a collective effort of all of us in this healthcare community saying you are still welcome. And we've got the resources, we've got the tools to continue to welcome you to our healthcare training courses and conferences, and you are welcome. Ask yourself every day if your technology is helping the poorest in the world and reducing inequalities. And if we truly care about global health, we truly care about global healthcare education. And that extends beyond welcoming people to virtual events. One of the things that is really important and we really leaned into is on demand. Why is that important? Well, if you live in a low-income country which doesn't have a good internet connection, or if you live in a high-income country and just part of it, like I do, that doesn't have a great internet connection, then watching live isn't always the hammer that cracks the problem. And actually being able to watch at a time and an internet connection that suits you is actually really important. And so we have automatically created a platform that allows healthcare organizations to automatically make their event available on demand and allow the attendee to give feedback and claim a certificate for watching at least 80% of that event. And what does that look like? Well, this is the wonderful result of a community effort. In the last 18 months, we have helped 1,300 healthcare organizations deliver 5,000 courses, many of which are open access. And they've delivered teaching and training to colleagues in 171 countries. What's even more amazing is that those colleagues were being taught by organizations from 20 countries. So those 20 countries worth of organizations were teaching and training colleagues in 171 countries. This is the power of community. But does it work? Does virtual education actually work? Can we actually train healthcare professionals online? Well, I come from a surgical background. I was an academic registrar in cardiac surgery before jumping into the world of medtech. And if I had read this title, I wouldn't have believed it until I started to look at the information. Can surgical skills be taught using technological advances online? This is a study from Matthias Ferravari, and some of the senior authors include David Knott from the David Knott Foundation, who teach and train colleagues in war zones around the world. And what they did was they actually picked up MedAll, actually without telling us, which is even more beautiful. So we had nothing to do with the editorial content of this paper, and it was really interesting to see it for the first time. But what they actually did was they ran a basic surgical skills course online, and they ran a basic surgical skills course face-to-face. And they compared the competency outcomes of the delegates from both afterwards. And this is what that paper said. There was no significant difference in the competency ratings of delegates receiving online teaching or face-to-face teaching. And their conclusion was online teaching of surgical skills for early year trainings is an appropriate alternative for face-to-face teaching. I was amazed. This has the power to really change how we deliver education around the world. Not just by making it less personal, but by making it more accessible, and that's really important. And the results weren't just at a small scale, but they were able to make accessible surgical training available at scale. And they taught 553 junior surgeons in 20 countries in the single course. Absolutely incredible. On a personal level, as well as at a scale level, this is the impact of making healthcare teaching and training accessible. Not because we want to help people tick boxes, but because it actually makes an impact on patient care. This is from Dawn Stevens, who is a parish nurse in England. And she said, because of your webinar, which is being run by the amazing organization Learn with Nurses, on women and cardiovascular disease, I was able to spot the signs and get a patient urgent care today. The signs had been missed for a while. More understanding is definitely needed in this area. Actually making education flexible helps to teach and train people and give them knowledge that they may otherwise never have been able to accrue. Why is that important? Because it gets patients the right care. I want to tell one last story about the impact of this type of education. And it happened in April of this year. We, as you will see on the right-hand side, actually verify colleagues who are joining events as healthcare professionals or students, and it helps us keep this community safe. It means that you can truly offer open access events, and you can keep them with a community feel, and you can trust who's joining. And occasionally, once or twice a week, we get people who are unable to join for whatever reason. And people can do that in multiple ways. They can use their institutional ID, they can use their email address, and they can verify themselves. But in 1 week, we actually, in one day, in fact, we actually got tens, if not hundreds of people kind of reaching out and saying, I can't verify myself for some reason. And one of our team members, Sue, actually reached out to some of those people and said, why are you unable to verify yourself, and can we help? And the response was consistent across those people. They said, I'm a medical student and I am from Ukraine, and I have not got access to my institutional ID, and I don't have access to my any letter from my dean to say I'm a healthcare professional who's eligible to join MedAll. And quite rightly so. They had fled the country, and there was an organization in England who had brought together 250 volunteer doctors from around the country to deliver teaching and training for 2,000 Ukrainian medical students throughout the conflict. The amazing organization was the Crisis Rescue Foundation, and they used MedAll to deliver on-demand education to over 2,000 Ukrainian medical students 7 times a day for 2 months. Why is that really interesting? Not just for some sort of imperialistic reason of one country delivering education to another, but instead it was a group of volunteer doctors who were freeing up Ukrainian medical professors. Instead of them having to provide face-to-face education, they were freed up to provide face-to-face patient care as qualified doctors. And this is what one of them had to say: thank you for everything you're doing for Dnipro and for all people who are trapped in this situation. This is the real-life impact of making healthcare training more accessible. We need to train 18 million more healthcare professionals by 2030. And at MedAll, we're really passionate about making that happen. We believe this is a community effort. We believe that all of us have to play our part. Sometimes that's uncomfortable. Sometimes, actually, with technology, it's challenging. But we have the opportunity in front of us to really change the face of healthcare training and its accessibility forever. If you want to join this mission, you can host an event. If you're running it free and open access, it's actually free and open access for you to run your event on MedAll. Don't be another barrier. It's a really core part of our mission. If you just want to find events to join, well, you find this one, so that's a good start, but medall.org/events. And if you want to watch on demand, you can watch medall.org/on-demand. We'd be really honored to help and support you, and we really believe in working together as a community. And that's why I want to leave you with this one last quote. This is not to big us up, it's not to blow our own trumpet, but there's 2 words in here that really mean so much to us, and they are enabled and they are empowered. This is from someone who has backed us from day one. Her name is Sarah Fryer. She's the CEO at Nextdoor. She's on the board of Slack. She's on the board of Walmart. She was Jack Dorsey's CFO. And her brother is an anaesthetist. And she has seen some of the challenges that healthcare has faced, and she's backed us genuinely from day one. But she said this about us: the MedAll platform has enabled and empowered the medical community to deliver medical education at a scale never before imaginable. And if that's the point we can get to, if we can get to the point where we only enable and empower others, then we are achieving our goal. This cannot be all about us. This is a community effort. I'm really proud and honored to work alongside so many wonderful organizations. Thank you so much for joining us today. And if you do want to hear more about how you can run an event on MedAll, join us at the end of today's event. We're going to be doing a practical session, and we can show you how you can get involved. And it would be our pleasure to help you. Thank you so much. And I think with that, we're going to move into our next session.